Well, good morning. I will open our subcommittee today. Our subcommittee will do a budget closing on the public health closing of the Division of Public and Behavioral Health. Thank you for being with us today on this Friday morning. Will the secretary please take the roll?
Senators Dondero Loop,
Here.
Stone, Titus,
Here.
Wynn,
Here.
Assembly members Brown May,
Here.
Dickman, Hafen, Hibbets, Howdigy, Monroe Moreno, Yeager, and Chair Mosca.
Here.
Thank you, and if we can please mark Assemblymember Hattigi present as she arrives, as well as Majority Leader Canizaro. Yes. Okay, thank you. And so for our housekeeping today, we will, remember to silence your cell phones. We are going to go over our closing, and at the end of the meeting, we will take public comment. So with that, we will hand it over to Mr. Barlow to handle our closing documents today.
Thank you, Madam Chair. Good morning, members of the committee. I am Morgan Barlow, Program Analyst for the Fiscal Analysis Division of the Legislative Council Bureau. Before the committee are the public health accounts for the Division of Public and Behavioral Health. It is anticipated that on Wednesday, April 16th, the behavioral health accounts will be presented before the subcommittee. Before the committee are 20 accounts related to public health, 7 of which were heard previously on February 19th at that budget hearing. Starting on page 3 is budget count 3223. The Office of Health Administration provides support services to program areas within the Division of Public and Behavioral Health and for the State Board of Health, including administrative and fiscal oversight, information technology support, human resource management, and public information officer support. The major closing issue that was highlighted for the hearing and for today was regarding position funding adjustments due to the expiration of American Rescue Plan Act, or ARPA, Coronavirus State Fiscal Recovery Funds. The governor recommends the removal of $2.8 million in ARPA funds that was authorized to support 13 positions, contractual, and associated expenditures during the 2023-25 biennium. Additionally, the governor recommends $1.8 million in reserve reductions and cost allocation revenue over the 2025-27 biennium to maintain funding for 8 of those 13 positions. On page 4 is a summary of those 8 positions that are recommended to be continued. During the February 19th hearing, the agency testified to the need to retain these 8 positions based on a workload analysis from fiscal year 2023, during which the Office of Health Administration processed over 500 contracts and nearly 500 subawards. The agency does not indicate that this workload will decrease over the biennium, and reported as of January 2025, it had already processed approximately 400 subawards and 300 contracts. According to the agency, eliminating all 13 of these positions would increase the strain and workload on existing staff. Regarding these 13 positions, during the hearing on February 19th, the agency reported that 10 of those 13 were currently vacant. And then the agency confirmed layoffs would be avoided and displaced personnel would be reassigned to existing vacancies where possible. Fiscal staff will recommend a technical adjustment. Of the 13 positions, 2 are recommended to continue through March 2027. However, under the governor's recommended budget, there was no ARPA authority allocated to support these 2 positions to finish up those administrative workload related to ARPA. Therefore, fiscal staff worked with the agency and the governor's finance office to ensure sufficient ARPA authority remains to support these positions through the time period. In summary, the decision unit E499, as adjusted, would eliminate 2 positions performing ARPA administrative tasks beginning March 2027 and would eliminate 11 positions beginning July 1st, 2025. Decision unit E599 would continue 8 positions beginning July 1st, 2025, previously supported by ARPA funding, but eliminated in decision E499, totaling $1.8 million in cost allocation revenue and reserve reductions. The decision for the subcommittee is as follows. Does the subcommittee wish to recommend approval of Decision Unit E499, elimination of $2.2 million in Federal American Rescue Plan Act, Coronavirus State Fiscally Recovery Fund Authority over the 2025 to 27 biennium, along with 11 positions and associated expenditures beginning July 1st, 2025, included the noted technical adjustments to retain $328,462 in FY 2026 and $199,225 in FY 2027 to support 2 ARPA-funded positions and administrative expenditures through March 2027, and Decision Unit E599, $1.8 million in cost allocation revenue and reserve reductions over the 2025 to 27 biennium to continue 8 positions previously funded with ARPA Coronavirus State Fiscal Recovery Funds as recommended by the Governor.
Thank you. Members, any questions? Seeing no questions, I'll take a motion.
So move to accept the recommendations as read by staff.
We have a motion from Senator Nguyen and a second from Assemblymember Monroe Moreno. Is there any discussion on the motion? All those in favor say aye. Aye. All those opposed say nay. The motion passes. Thank you.
Thank you, Madam Chair. Moving on to the other closing items for budget account 3223, I will note other closing item number 6 on page 6. Initially, when the budget account was built, there was a recommendation to transfer 3 positions from the Office of Health Administration to the Healthcare Facilities Regulation budget account. It was made known to us that these 3 positions were originally intended to be transferred to the Medicaid Administration budget account for the reorganization of the Department of Health and Human Services into the Nevada Health Authority. The Governor's Office, Finance Office, submitted Budget Amendment A25783-3223 on March 30th to revise this decision unit. And it makes 2 adjustments. First, it transfers the 3 positions correctly to the Medicaid Administration budget account, and also it reduces general fund appropriations and increases funding from reserves due to the loss of the indirect support following the transfer of the Healthcare Facility Regulation budget account to Nevada Health Authority. That'll be discussed here soon, but budget account 3216 and 3217 are part of the reorganization, and it is recommended that those are transferred from this the Department of Public and Behavioral Health to the Nevada Health Authority. The approval of the proposed position transfers and revenue adjustments, including Budget Amendment A25783-3223, are contingent upon the passage and approval of Bill Draft Request 1116 or other enabling legislation, which would implement the reorganization of the Department of Health and Human Services. I would also note other closing item 7, which is a technical adjustment, which would align transfers from the Public Health Improvements budget account to the Office of Health Administration budget account. Therefore, fiscal staff recommends other closing items 1 through 5 be closed as recommended by the Governor. Other closing item 6 be closed as amended with a budget amendment A25783-3223 and contingent upon the approval of Bill Draft Request 1116 or other enabling legislation. Other closing item 7 be closed with a noted technical adjustment and request authority to make other technical adjustments as necessary.
Thank you. Members, are there any questions? Hearing no questions, I'll take a motion.
I'd so move to close items 1 through 5 as recommended by staff.
We have a motion from Senator Nguyen and a second from Assemblymember Monroe Moreno. Any discussion on the motion? All those in favor say aye. Aye. All those opposed say nay. Motion passes. Thank you.
Thank you, Madam Chair. That takes us to page 9, budget account 3194. The Environmental Health Services Program permits and inspects food establishments and various other facilities and in businesses to ensure safe sanitary standards to protect public health maintained in the state. The major issue that was brought before the committee and during the budget hearing was the elimination of this account, rather the transfer of different components of the account to the Department of Agriculture and also to the Healthcare Facilities Regulation. The Governor recommends eliminating the Environmental Health Service budget account by transferring $4.4 million in reserves and associated expenditures, including 12 positions, to the State Department of Agriculture's Dairy Fund and $1.7 million in reserves and associated expenditures, including 3 positions, to the Healthcare Facilities Regulation Program. Turning attention to page 11, one of the major concerns that was brought before the committees and during that February 19th budget hearing was the solvency of the functionalities and the programs that were going to be transferred to the state Department of Agriculture Dairy Fund. A review of the Environmental Services Program highlights a program imbalance in the revenues and expenditures transferred by Decision Unit E905. Excluding balance forward revenue, the projected revenue and expenditure levels indicated a widening gap between operational expenditures and incoming revenue. During the hearing on February 19th, the agency reiterated a fee analysis was completed for the Environmental Health Services Program, which confirmed current fees are insufficient to support the program. However, the agency indicated the transfer of reserves are intended to temporarily sustain the program while the State Department of Agriculture evaluates necessary fee adjustments and long-term solutions. The Division of Public and Behavioral Health indicated the goal is to ensure the long-term solvency of the transferred program, and the recommended transfer was not the primarily cause of an insolvent fee structure. On top of page 13 is a table that illustrates the program components that are being transferred to the State Department of Agriculture, the Dairy Fund, and also to the Healthcare Facilities Regulation budget account, which once again is going to be recommended to be transferred from the Division of Public and Behavioral Health to the new Nevada Health Authority. Given the identified structural deficit and the reliance on transferred revenues to sustain program operations in the near term, a letter of intent directing the agency responsible for food-related programs currently overseen by Environmental Health Services to develop a long-term, sustainable plan to align this program's revenues and expenditures appears reasonable. This recommendation is contingent upon the passage and approval of Bill Draft Request 1121 or other enabling legislation. The decision for the subcommittee is as follows. Does the subcommittee wish to recommend approval of the elimination of the Environmental Health Services budget account by transferring its associated services, revenues, expenditures, and personnel to the State Department of Agriculture's Dairy Fund and to the Health Care Facilities Regulation Program, contingent upon passage and approval of enabling legislation as recommended by the governor? And does the subcommittee wish to recommend a letter of intent directing the agency responsible for the food-related programs currently overseen by the Environmental Health Services, i.e. the Department of Agriculture, if the recommended program transfers are approved, to develop a long-term, sustainable plan to align this program's revenues and expenditures to be submitted for review by the Interim Finance Committee no later than April 2026 meeting?
Thank you. Members, any questions? Seeing none, I'll take a motion.
I'd so move to accept the recommendations as read by staff.
We have a motion from Senator Nguyen and a second from Assemblymember Monroe Moreno. Any discussion on the motion? All those in favor say aye. Aye. All those opposed say nay. Motion passes. Thank you.
Thank you, Madam Chair. Moving on to page 14, other closing items for the budget account. There are no other closing items of note. Therefore, fiscal staff recommends other closing item 1 be closed as recommended by the governor and requests authority to make technical adjustments as necessary.
Thank you, members. Any questions? Hearing no questions, I'll take a motion.
I'd so move to accept the recommendations of fiscal staff.
A second. We have a motion from Senator Nguyen and a second from Assemblymember Monroe Moreno. Any discussion on the motion? All those in favor say aye. Aye.
Aye.
All those opposed say nay. Motion passes. Thank you.
Thank you. That moves us on to page 15. Budget account 3219, the Office of Public Health Investigations and Epidemiology Office, also referred to simply as the Office of State Epidemiology. This office conducts disease surveillance, investigates disease outbreaks, and provides timely and relevant data and statistics to support public health stakeholders. The major issue that was brought before the committee and discussed on February 19th was that of a new medical epidemiologist position. The governor recommends approximately $520,000 in opioid transfers from the Fund for a Resilient Nevada budget account over the biennium to fund one new unclassified medical epidemiologist position and associated expenditures to support the office. During the February 19th hearing, the agency stated the medical epidemiologist would serve as a liaison and technical expert on epidemiology, supporting various boards, committees, work groups, and meetings related to opioid funding, prevention, treatment, and data analysis. Additionally, the agency indicated the position would facilitate a new collaborative team focused on assessing data, prioritizing issues, and developing a syndemic plan which addresses the intersection of the opioid crisis and infectious diseases. According to the agency, the medical epidemiologist would address both areas, including opioid-related substance abuse and infectious disease prevention. At this time, the agency indicated there are no immediate plans to expand the program beyond the medical epidemiologist position. Regarding the long-term funding of this position, the agency acknowledged opioid settlement funds are not permanent and indicated program needs would be continuously assessed to determine future funding allocations. The decision for the subcommittee is as follows. Does the subcommittee wish to recommend approval of $520,468 in opioid funding transferred from the Fund for a Resilient Nevada budget account over the 2025-27 biennium to fund one new unclassified medical epidemiologist position and associated expenditures as recommended by the governor?
Thank you. Members, any questions? Go to Senator Titus.
Thank you, Madam Chair. I want a clarification, please, that this is truly a new recommendation and that there's no one currently in this position.
Correct. This is a new position.
All right, thank you.
Thank you. Members, any other questions? I'll take a motion.
Thank you, Chair. In light of the recent cuts on March 24th and 25th of 2025, which were terminations that resulted in reductions in federal funding totaling $22.7 million each year in the 2025-2027 biennium, I think at this point it is unfortunately not a responsible move to be able to start this new position. And again, I appreciate Senator Titus pointing out and clarifying that this is a new position. So it would be my motion to not approve the $520,468,000 in opioid funding transferred from the Fund for Resilient Nevada budget account over the 25-27 biennium to cover this one new unclassified medical epidemiologist position and associated expenditures as recommended by the governor.
Do we have a second?
Second.
We have the motion from Senator Nguyen. We have a second from Assemblymember Monroe Moreno. Is there any discussion on the motion? All those in favor say aye. Aye. All opposed say nay. And the motion passes. Thank you.
Thank you. That moves us to other closing items for budget account 3219 on page 17. I will note other closing item number 6. Fiscal staff recommends a technical adjustment to address ARPA authority and align the authority with agency projections. Other closing item number 7, as Senator Nguyen actually just mentioned, is regarding those cuts. On March 24th and 25th of 2025, the Division of Public and Behavioral Health was notified by the federal government that 6 awards to the division for COVID-19 response efforts were terminated effective on March 24th, 2025. According to the agency, the terminations result in reductions in federal funding totaling $22.7 million in each year of the 2025-27 biennium. This funding specifically impacting the COVID-19 related epidemiology and laboratory capacity activities. This funding source supported COVID-19 tracing, investigation, and mitigation efforts and was primarily provided to counties in the form of subawards. According to the governor's recommended budget and the agency provided projections, the reduction would not eliminate all available funding for the 2025-27 biennium, and no permanent positions appear to be directly impacted by the funding loss. Fiscal staff recommends a technical adjustment to remove these funds in each year of the 2025-27 biennium. And would note that this is, as many of us are aware, is still an ongoing and an evolving scenario, and we will provide the committees with additional information as they come out. but therefore fiscal staff recommends other closing items 1 through 5 be closed as recommended by the governor. Other closing items 6 and 7 be closed with the noted technical adjustments, and request authority to make other technical adjustments as necessary.
Thank you. Members, any questions? Hearing none, I'll take a motion.
I'd so move to accept the recommendations on closing as read by staff.
Second.
We have a motion from Senator Nguyen and a second from Assemblymember Monroe Moreno. Any discussion on the motion? All those in favor say aye. Aye.
Aye.
All those opposed say nay. The motion passes. Thank you.
Thank you, Madam Chair. That brings us to page 19, budget account 3222. The Maternal Health Child Program works to improve health of at-risk families, pregnant and postpartum women, infants, children, adolescents, and children with special health care needs. The major closing issue brought before the committee is the recommendation for a new perinatal quality collaborative program. The governor recommends approximately $689,000 in opioid settlement funds transferred from the Fund for Resilient Nevada over the 2025-27 biennium to establish a new perinatal quality collaborative program and associated contract expenditures, one new health program specialist position, grade 35, and associated expenditures to support program implementation and administration. According to the agency during the hearing, the Perinatal Quality Collaborative Program would seek to improve maternal and infant health and end preventable maternal and infant mortality and morbidity by developing statewide protocols to prevent substance use during pregnancy and expand evidence-based services for substance-exposed infants, including but not limited to those affected by opioid exposure. Additionally, during the February 19th hearing, the agency outlined and addressed concerns with this new collaborative overlapping with various other entities in the state providing similar services, such as the Maternal Child Health Advisory Board and nonprofits, such as the Empowered Program. During the hearing, the agency indicated that this new collaborative program would differ from these organizations as it would function as the clinical quality improvement lead for the state. And through this program, it would provide evidence-based interventions to improve neonatal and maternal health outcomes. The decision for the subcommittee, therefore, is as follows. Does the subcommittee wish to recommend approval of $688,968 in opioid funding transferred from the Fund for a Resilient Nevada budget account over the 2025-27 biennium to establish a new perinatal quality collaborative program, including one new health program specialist position, grade 35, and associated program expenditures as recommended by the governor?
Thank you. Members, any questions? Seeing none, I'll take a motion.
Thank you, Chair. While I appreciate the intent behind wanting to create these new positions and these new contract positions and these new procedures around perinatal quality collaborative programs, what we heard during the hearing is there are a lot of nonprofits, including Empowered Program and the Maternal Children Health Advisory Board and other nonprofits that are doing this. So at this time, it is my recommendation that the subcommittee not approve the $688,968 in opioid funding transferred from the Fund for Resilient Nevada budget account over the 25-27 biennium to establish new perinatal quality collaborative programs, including one new health program specialist position, grade 5, and associated program expenditures such as recommended by the governor.
Second.
We have a motion from Senator Nguyen and we have a second from Assemblymember Monroe Moreno. Is there any discussion on the motion? All those in favor say aye. Aye.
Aye.
All those opposed say nay. Motion passes. Thank you.
Thank you. That takes us to the other closing items for budget count 3222. I will just point out other closing item number 8, which is a technical adjustment to once again align ARPA authority within the budget count according to agency projections. And other closing item number 7, the Appropriations Act language. The governor recommends language in the 2025 Appropriations Act similar to the language in the 2023 Appropriations Act regarding this budget account. Therefore, fiscal staff recommends other closing items 1 through 7 and 9 be closed as recommended by the governor, other closing item 8 be closed with the noted technical adjustments, and request authority to make other technical adjustments as necessary.
Thank you. Members, any questions? Seeing none, I'll take a motion.
I'd so move to accept the recommendations as read by staff.
Second.
We have a motion from Senator Nguyen. We have a second from Assembly Member Monroe Moreno. Any discussion on the motion? All those in favor say aye. Aye.
Aye.
All those opposed say nay. And motion passes. Thank you.
Thank you, Madam Chair. That takes us to page 23, which is budget account 3234, the Public Health Improvements Program. This budget account was established during the 82nd or 2023 legislative session to account for revenues and expenditures for the Public Health Infrastructure and Improvement Program funded through ARPA funding. Additionally, during that session, Senate Bill 118 appropriated general funds of $15 million to also support, among other things, public health districts. The major issue brought before the subcommittee and discussed was the ongoing general fund and ARPA funding for this budget account. For the 2025-27 biennium, the governor recommends $15 million in general fund appropriations over the biennium in the base budget to support the Public Health Infrastructure and Improvements Program. Additionally, the governor recommends the reduction of $6.1 million in federal ARPA funds authority to eliminate one-time program support approved over the 2023-25 biennium. During the discussion, the budget hearing on February 19th, the agency provided clarification regarding the funding allocations outlined in Senate Bill 118 of the 2023 legislative session and the use of ARPA funds and the recommended funding structure for the 2025-27 biennium. The agency confirmed all ARPA funds allocated to support public health districts are expected to be fully expended by the end of the ARPA project period of December 31st, 2026. However, the governor's recommended budget does not include any ARPA revenue or expenditures for the 2025-27 biennium, as ARPA funding was eliminated through E499 decision unit. Fiscal staff recommends a technical adjustment to account for agency projected expenditures, resulting in the inclusion of ARPA Coronavirus State Fiscal Recovery Funds Revenue and Expense Authority totaling $6.9 million in FY 2026 and $3.5 million in FY 2027 to support local and regional health districts. On the topic of the Senate Bill 118 General Fund Appropriations, during that hearing, the agency provided and testified that counties and health authorities were able to effectively use their general fund appropriations for various targeted projects within their health districts. The agency indicated general fund appropriations recommended for this 25 to 27 biennium would continue to follow the proportional allocations set forth in Senate Bill 118 of the 2023 legislative session in the future. The table at the bottom of page 25 illustrates that statement, the allocation of the current recommendation to the public health districts, and then the allocations that were built in Senate Bill 118. During the currently, the general fund appropriations are located in a single category for the 2025-27 biennium, and when discussed during the budget hearing, the agency indicated that it was receptive to delineating appropriations by health district and the Division of Public and Behavioral Health. Additionally, the same table on 25 proposes that scenario, how the budget account could be built to include each of these health districts in its own category opposed to a single-use category. While the proposed scenario does not differ from the spending allocation as proposed by the agency, it would ensure that any changes between categories would be subject to review and approval by the governor's Office of Finance and, as necessary, by the Interim Finance Committee in accordance with the procedure for revising work program provisions. Additionally, given the reporting requirements outlined in SB 118, Senate Bill 118 of the 2023 legislative session, were transitory and the subcommittee expressed an interest in keeping appraised of how funds are expended, a letter of intent may be beneficial to establish ongoing reporting of the Public Health Improvements Program. A letter of intent would require the agency to submit annual reports to the IFC, maintaining the same reporting elements as Senate Bill 118 of the 2023 legislative session. Therefore, the decisions for the subcommittees are as follows. First, Decision Unit E499. Does the subcommittee wish to recommend approval of technical adjustments to include total ARPA Coronavirus State Fiscal Recovery Fund Authority of $6.9 million in FY fiscal year 2026 and $3.5 million in fiscal year 2027 to support public health districts as projected by the agency? And 2, Base Decision Unit. Does the subcommittee wish to recommend approval of $7.5 million in general fund appropriations each year of the 2025-27 biennium to support the Public Health Infrastructure and Improvement Program, option 2A, in a single expenditure category, which would allow the agency to make allocation adjustments without requesting work program revisions, or option 2B, in separate expenditure categories as outlined in the preceding table, which would require any allocation adjustments to be subject to the work program revision provisions of Nevada Revised Statute Chapter 353. And third, letter of intent. Does the subcommittee wish to recommend a letter of intent requiring the agency to submit annual reports to the Interim Finance Committee incorporating reporting elements from Senate Bill 118 of the 2023 legislative session?
Thank you. Members, any questions? Seeing none, I'll take a motion.
Thank you. I would recommend that the subcommittee approve the technical adjustments to include ARPA Coronavirus State Fiscal Recovery Fund Authority of $6.9 million in fiscal year 2026 and $3.5 million in fiscal year 2027 to support public health districts as projected by the agency. Additionally, I would recommend that the subcommittee approve $7.5 million in general fund appropriations each year of the 25-27 biennium to support public health infrastructure and improvements program. I would also recommend that in this for purposes of transparency, that this be in separate expenditure categories as outlined in the table that was discussed by staff just now, which will require any allocation adjustments to be subject to work program revision provisions through NRS Chapter 353. And finally, I would recommend, consistent with what we did in Senate Bill 118 in the 23 legislative session, that a letter of intent requiring the agency to submit annual reports to the Interim Finance Committee incorporating the reporting elements, again, from Senate Bill 118 be included.
Second.
Thank you so much. We have a motion from Senator Nguyen. We have a second from Assemblymember Monroe Moreno. Is there any discussion on the motion? All those in favor say aye.
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 All those opposed say nay. And the motion passes. Thank you.
Thank you. That takes us to the other closing items for budget account 3234. I will note other closing item 5 is a base ARPA funding technical adjustment, and that is to align ARPA authority for projects and ARPA funding that was approved by the Interim Finance Committee during the 2023-25 interim. Additionally, other closing item 6, another technical adjustment to consolidate 2 ledger lines into a single transfer general ledger and increase the transfer amount to align with the transfers between 2 budget accounts. Therefore, fiscal staff recommends other closing item 1 through 4 be closed as recommended by the governor. Other closing item 5 and 6 be closed with the noted technical adjustments, and request authority to make other technical adjustments as necessary.
Thank you. Members, any questions? Hearing no questions, I'll take a motion.
I'd so move that we follow the recommendations of staff as just read.
Second.
We have a motion from Senator Nguyen and a second from Assemblymember Monroe Moreno. Is there any discussion on the motion? All those in favor say aye. Aye.
Aye.
All those opposed say nay. Motion passes. Thank you.
Thank you, Madam Chair. That takes us to page 29, budget account 3155, the family planning budget account, which provides grants to local governmental and nonprofit organizations to provide and pay for family planning services which are provided by or contracted by an executive branch agency. Budget Account 3155 was heard during the February 19th hearing, but there were no concerns or discussions during that budget hearing, and there were no major issues identified by fiscal staff. I will note the other closing items. They're on page 29, but fiscal or staff recommends that this budget be closed as recommended by the governor and requests authority to make other technical adjustments as necessary.
Thank you. Members, any questions? Hearing no questions, I'll take a motion.
I so move to accept the recommendations as read by staff.
Second.
We have a motion from Senator Nguyen and a second from Assemblymember Monroe Moreno. Any discussion on the motion? All those in favor say aye. Aye.
Aye.
All those opposed say nay. Motion passes.
Thank you, Madam Chair. That brings us to page 31, Budget Account 3213, the Immunization Program Budget Account, which is responsible for the activities to prevent and respond to the occurrence of vaccine-preventable diseases in Nevada by promoting immunizations and providing vaccines. Similar to the previous budget account, this budget account was heard during the February 19th budget hearing. However, no concerns or discussions were brought up during the hearing, and no major issues were identified by fiscal staff. I will note, however, the other closing items on page 32, starting with other closing item 6. The agency has provided updated caseload adjustments for vaccine purchases, and therefore, fiscal staff recommends technical adjustments to reflect updated caseload projections provided by the agency, totaling a approximate $69,000 general fund appropriation reduction, and also an approximate $167,000 in federal Title 21 revenue. Those adjustments are shown in the table in the middle of page 32. I will also point out other closing item 7, which is a reduction in the budget account from the Fund for Healthy Nevada. The Fund for Healthy Nevada are the tobacco settlement funds. That budget account, the Grants Management Unit, will be brought before the subcommittee next week on April 8th, I believe, which will also be me, so sorry. And so there were a total of 12 budget amendments submitted by the Governor's Finance Office on March 17th, which reduces the overall revenue and expenditure projections related to tobacco settlement funds. This budget account is one of those budget accounts that is impacted by that overall revenue reduction. The reduction would remove all Healthy Nevada funding for the immunization program, and that is through the budget amendment A 25-510-3213. Additionally, I will note out other closing item 8, which is additional Appropriations Act language. The governor recommends language in the 2025 Appropriations Act for this budget account, similar to the language that was included in the 2023 Appropriations Act. And with that, fiscal staff recommends other closing items 1 through 5 and 8 be closed as recommended by the governor. Other closing item be closed with the technical adjustments noted. Other closing item 7 be closed to include budget amendment A 25-510-3213 and request authority to make other technical adjustments as necessary.
Thank you. Members, any questions? Hearing no questions, I'll take a motion.
I'd so move to accept the recommendations as just read by staff.
Second.
We have a motion from Senator Nguyen and a second from Assemblymember Monroe Moreno. Any discussion on the motion? All those in favor say aye. Aye.
Aye.
All those opposed say nay. Motion passes. Thank you.
Thank you, Madam Chair. That brings us to budget account 3224, the Community Health Services Program. This budget account was not heard before the subcommittee on February 19th. However, this budget account, several major issues were identified after the hearing, including revenue projections, ARPA funding allocations, and solvency concerns for the budget account. The Community Health Services Program provides direct public health preparedness services in rural communities, including public health nursing, family planning, and the diagnosis and treatment of sexually transmitted diseases. Over the past several sessions, there have been solvency concerns related to this budget account. When fiscal staff went back and reviewed to confirm the revenue projections As stated before, revenue concerns were identified, and which also relate to budget solvency concerns. Upon working through these issues, those additional concerns were identified regarding ARPA. And from that work, the Governor's Office of Finance submitted a budget amendment on April 1st to address the revenue concerns from the county participation fees, transfer revenue authority concerns, reductions in ARPA, balance forward and reserve authority, and also the elimination of vacant positions to align expenditures with available funding. The executive budget overstates the projected amount of county participation revenue available by approximately $89,000 in fiscal year 2026 and approximately $173,000 in fiscal year 2027 when compared to the agency provided contractual projections. Additionally, the executive budget included approximately $495,000 of transfer revenue, which should not have been included in the 2025 to 27 biennium. And then again, the methodology for the elimination of ARPA funds were identified. And through this budget amendment, I'll direct your attention to the table on page 37. Through budget amendment A25-793-3224, the budget amendment corrects the county participation revenue by a reduction of $261,410 over the biennium to align with the agency's projections for county participation revenue. It also addresses the transfer revenue from the Substance Abuse Prevention, Treatment, and Recovery Service and Environmental Health Services transfers. The budget amendment reduces other revenue resources to align with expenditures. And fourth, the budget amendment A25-793-3224 revises decision unit E499 to eliminate all ARPA balance forward revenue and associated ARPA reserves, which were built in the budget, which should have been removed. In order to address the solvency concerns, the governor recommends through decision unit E608 a reduction of approximately $263,000 in fiscal year 2026 and a reduction of approximately $354,000 in fiscal year 2027 to eliminate 4 vacant positions that have been vacant more than 2 years to address the solvency concerns. However, when working through this budget account, it was identified that would not quite meet the need of the solvency concern, and therefore the budget amendment recommends an additional position to be eliminated, which has also been vacant for more than 2 years. In total, the revised budget amendment A257-93-3224 results in a net reduction of $3.2 million in fiscal year 2026, which includes a approximately $2,000 general fund reduction, and a net reduction of $1.5 million in fiscal year 2027, which includes approximately $58,000 general fund increase to correct the overprojected fee revenue, eliminate improper transfer revenue, and mitigate potential solvency concerns. Side note, greatly appreciate the Governor's Finance Office on working on this and Crystal Novotny in building these budget amendments to address these concerns. But the decision for the subcommittee is as follows. Does the subcommittee wish to recommend approval of revised budget amendment A25-793-3224, which would result in a net reduction of $3.2 million with a $2,203 general fund reduction in fiscal year 2026, and a net reduction of $1.5 million with a $58,093 general fund increase in fiscal year 2027, and the elimination of 5 positions?
Thank you, Mr. Barlow. Any questions, members? Senator Wynn.
I just wanted to clarify. I think you said this very clearly, but we didn't hear this, and you're bringing this to our attention because obviously there were some issues with it. So I appreciate you bringing it to our attention. But just to clarify, the elimination of those 5 positions that you had discussed in the recommendations for this committee, those are currently vacant.
Correct. All those 5 positions have been identified vacant more than 2 years.
Thank you.
Thank you. Seeing no other questions, I'll take a motion.
Chair, I would recommend that we approve the motion as recommended and read by staff just before I started talking again.
Second.
We have a motion from Senator Nguyen and a second from Assemblymember Monroe Moreno. Is there any discussion on the motion? All those in favor say aye. Aye.
Aye.
All those opposed say nay. And the motion passes. Thank you.
Thank you, Madam Chair. That brings us to the other closing items for budget account 3224. I will just note other closing item 5, which is again is a ARPA related technical adjustment by staff to align ARPA authority to meet agency projections. With that, fiscal staff recommends other closing items 1 through 4 be approved as recommended by the governor. Other closing item 5 be closed with technical adjustments noted, and request authority to make other technical adjustments as necessary.
Thank you, members. Any questions? Seeing none, I'll take a motion.
I'd so move to accept the recommendations as read by staff.
Second.
Thank you. We have a motion from Senator Nguyen and a second from Assemblymember Monroe Moreno. Is there any discussion on the motion? All those in favor say aye. Aye.
Aye.
All those opposed say nay. And the motion passes.
Thank you, Madam Chair. That takes us to page 39. This is the start of the staff closed budget accounts. As a reminder, fiscal staff is responsible for developing recommendations for the following budgets. They will be a singular motion at the end of the staff closed budget accounts. In other words, at the very end of the packet is the singular motion for all staff closed budgets. I am happy to pause in between each budget account if there are questions, or wait until the end.
We can wait until the end. Thank you so
Okay.
much.
Then strap in. Starting with budget account 3101, the radiation control. The radiation control program regulates and provides information on sources of ionizing radiation. There were no major closing issues identified, and the other closing items are there on page 39. Page 41, budget account 3152, the lower level radioactive waste fund. This fund was established during the 51st legislative session of 1961 for the fees collected for the disposal of both low-level radioactive waste and hazardous waste materials at the Betty, Nevada facility. The radiation control monitors radioactive materials at the site by conducting health and safety inspections and providing maintenance. There were no major issues identified. The other closing items there are on page 41. Page 43, budget account 3153, Nevada Central Counselor Registry account. This registry collects, registers, and maintains records of reportable causes of cancer occurring in the state. No major closing issues were identified, with other items stated on page 43. Page 45, budget account 3190, the Health Statistics and Planning Budget Account, or Office of Vital Records. This office serves as the official permanent custodian of the state's original vital records and is responsible for issuing certificates of birth and death certificates, maintaining and protecting all vital records, and managing corrections and amendments to legal documents. No major issues were identified. Other closing items there on page 45. Page 47, budget account 3214. The Special Supplement Nutrition Program for Women, Infants, and Children, also known as WIC, is a short-term intervention program designed to promote lifetime nutrition and health behaviors in high-risk populations. There were no major issues identified in this budget account, with other closing items on page 47. Page 49, budget account 3215, Communicable Diseases. The Communicable Diseases budget works to reduce the incidence and prevalence of human immunodeficiency virus and acquired immune deficiency syndrome in Nevada. There were no major issues identified, with other closing items on page 49. Page 51, budget account 3216, Healthcare Facilities Regulation Budget Account. This program licenses and regulates medical and health facilities and medical laboratories. I will note that this budget account, 3216, and the following budget account, 3217, these are both recommended to be transferred to the Nevada Health Authority in line with the proposed reorganization of the Department of Health and Human Services. Again, that will be contingent upon the passage and approval of Bill Draft Request 1116 and other enabling legislation. For budget account 3216, there were no major issues identified. However, I will make note of the other items on page 52. At the beginning of this meeting, in the Office of Health Administration budget account, the 3223, we discussed Budget Amendment A25-783-3223, which corrected the transfer of 3 positions from the Office of Administration account to the Medicaid budget account. As a reminder, the executive budget indicates that those 3 positions would be coming to this budget account, the office, or the Healthcare Facilities Regulation budget account. And so if a budget amendment A25-783-3223 was approved by the subcommittee in that budget account, and with that approval, it will address this decision unit E906 to correct the discrepancy in those transfers. Other closing item 7 is a recommendation to address the health facility license renewal dates. However, this recommendation is contingent upon the passage and approval of Assembly Bill 544 of this session or other enabling legislation which would allow license to expire 12 months after issuance opposed to at the end of each calendar year. Other closing item 8 is addressing the removal of ARPA coronavirus funds. Other closing item 9 is the transfer of funds for indirect expenditures to reserves. The governor recommends a reduction of $1.2 million in fiscal year 2026 and $2.3 million in fiscal year 2025 in indirect expenditures, reallocating these funds to reserves to offset the amounts which would have been transferred to the division's Office of Health Administration budget account as indirect cost revenue. Again, so these are costs that would have gone to the Health Administration budget account. However, since these are proposed to be transferred to the Nevada Health Authority, that administration budget account will no longer receive these cost allocations funds. However, this decision unit is contingent once again upon that Bill Draft Request 1116 for the restructuring of the Department of Health and Human Services. And then finally, other closing item 10, which is a technical adjustment recommended by staff to align revenue with expenditure, properly aligned transfer revenue received in the account. I'll move on to page 55, which is 3217, the Healthcare Facilities Administration Penalty Budget Count, which includes administrative sanctions, revenues collected from health facilities found to be in violation of statutes and regulations. There were no major issues identified, and as mentioned before, this is part of the restructuring of the Department of Health and Human Services and is recommended to be transferred to the new Nevada Health Authority contingent upon approval of Bill Draft Request 1116. There are no associated decision units or expenditures that are included in this budget account. Moving on to page 57, budget account 3218, the Public Health Preparedness Program. This program supports activities such as emergency preparedness and mitigation, healthcare planning and response for medical emergency, mass casualty or illness events, and improving hospital response infrastructure within the state. I will note the technical adjustment recommended in other closing item 7 on page 58, just to correct an incorrect expenditure category. Fiscal staff recommends that be corrected. Moving on to page 59, which is budget account 3220, the chronic disease. Budget funds various programs that work to control, prevent, and track the incidence and prevalence of communicable and chronic disease among Nevadans. Additionally, there are other closing items on page 60 that I will point out. First is other closing item 6, which again addresses the removal of ARPA fund authority. Other closing item 7 is again a reduction in fund for Healthy Nevada funds. Similar to a previous budget that we've discussed, this budget count is impacted by that overall revenue and expenditure projection from the Fund for Healthy Nevada. And in this budget account, through Budget Amendment A25-541-3220, That addresses the reduction in funds for this budget account from the Healthy Fund, from the Fund for Healthy Nevada. Moving on to page 63, budget account 3235, Emergency Medical Services. This program establishes and enforces standards for the provision of quality pre-hospital emergency medical care, the operation of ambulance services, certification of emergency medical services personnel, licensure of ambulance attendants, and the delivery of trauma care. There were no major issues identified with other closing items on page 64. Last but not least, that brings us to page 65, which is budget account 4547, the Marijuana Health Registry. This program administers the provisions of the Medical Marijuana Registry. There were no major issues identified with other closing items there on page 65. With that, we come to the recommendation for the staff closed budgets, which is found on page 67. Fiscal staff recommends that the following budgets be closed as recommended by the governor, with the technical adjustments noted, and request authority for staff to make other technical adjustments as necessary. Radiation control, lower level radioactive waste fund, Nevada Central Cancer Registry, health statistics and planning, WIC food supplement, communicable diseases, Healthcare Facilities Regulation Budget, with other closing item 6 consistent with actions on budget amendment A257833223 and the Office of Health Administration budget account. Other closing item 7 contingent upon passage and approval of Assembly Bill 544 or other enabling legislation. Other closing item 9 contingent upon approval of enabling legislation, and other closing 10 with the noted technical adjustments. Healthcare Facilities Admin Penalty Budget Account, Public Health Preparedness Program, and other closing item 7 closed with the noted technical adjustments to correct budget categories. Chronic disease, with other closing item 6 closed with the noted technical adjustments to align projected ARPA Coronavirus State Fiscal Recovery Fund revenue and expenditure authority, and other closing item 7, including budget amendment A255413220 to reduce revenue transfers from the Fund for Healthy Nevada Tobacco Settlement Funds, Emergency Medical Services, and Marijuana Health Registry.
Thank you, Mr. Barlow. That was pretty quick, so we appreciate it. Members, are there any questions? Hearing no questions, I'll take a motion.
I'd so move to recommend the closings as recommended by staff.
Second.
Thank you. We have a motion from Senator Nguyen and a second from Assemblymember Monroe Moreno. Any discussion on the motion? All those in favor say aye. Aye.
Aye.
All those opposed say nay, and the motion passes. Okay, well, thank you so much. We appreciate it, and with that, we will move on to our last item for the day, which is public comment. To provide public comment or testimony over the phone, please dial 888-475-4499. When prompted, please provide the meeting ID 847-994-97486 and then press pound. You will have 2 minutes. Please don't forget to state and spell your name for the record for our committee secretaries, and you may begin up here in Carson City when you are ready.
Thank you. For the record, Dr. Chad Kingsley, CHAD, KINGSLEY. I'm the District Health Officer for Northern Nevada Public Health, Washoe County's Health District. I want to thank you for the preservation of non-categorical funding, line item 3234. This is the only non-categorical state support for our local public health. Nevada cannot currently rely on federal funding, money that was direct cost savings for our local and state economies. Public health is about prevention. That includes preventing the weakening of our economies and schools. When our communities are sick, productivity, education, and longevity decrease. We don't know what's ahead, but knowing we have Nevada dollars invested in our local health authorities helps us plan and prepare. Thank you very much.
Good morning, and thank you, committee. My name is Amy Hines Sutherland, AMYHYNE-SUTHERLAND. I'm the Health and Human Services Manager for the Nevada Association of Counties. And I just wanted to thank you for the continuation of the SB 118 funds. In addition to the significant positive operational impacts to our state's health districts, program saving impacts in many cases, in the face of decreases and cuts in grant funding, SB 118 also elevated local boards of health decision-making in rural and frontier counties, strengthening our governmental public health system. And this is critical funding, so thank you for that. NACO also wants to thank DPBH leadership for working with the counties so well throughout this process, the governor for extending this funding recommendation, and again, to this committee, thank you so much. It's critically needed.
Thank you. And with that, we will move to Las Vegas.
Good morning. My name is Emma Rodriguez, EMMA.
If you can move a little closer to the mic, thank you.
Oh, can you hear me now?
Yes,
that better?
thank you.
Okay. Emma Rodriguez, EMMA, RODRIGUEZ. I'm the Communications and Legislative Affairs Administrator at the Southern Nevada Health District. Like the others, I just want to thank the subcommittees on Human Services for approving this essential funding for public health. SB 118 from the 2023 legislative session provided vital support for Nevada's public health system. It was created to give those providing foundational public health services flexible resources to respond to specific challenges, such as the scenarios we are seeing play out now at the federal level. The recent clawback of federal funds included both the loss of direct and pass-through funding for our agency. This unprecedented loss of funding has public health agencies at the state and local level struggling to identify how we will continue to provide essential public health services to our community. This includes core services that are vital to the health and safety of our community. Our ability to identify and track outbreaks of communicable diseases and provide services such as immunizations, HIV and sexual health testing and treatment, behavioral health services, and more could all be at risk. As we navigate these funding cuts with the potential for further reductions, the demand and burden on public health is sure to grow. Non-categorical funds give us the flexibility to respond to emerging needs, and it is now more critical than ever. Thank you again for your support for public health.
Thank you. Seeing no others in Las Vegas, AVH will please open the phone lines for public comment.
Thank you, Chair. The public lines are open and working. However, there are no callers at this time.
Okay, thank you. With that, we want to thank again the Department of Health and Human Services Division of Public and Behavioral Health for all that they do. Thank our members and thank Mr. Barlow, who will see him and the fiscal staff, and we'll see you all again on Tuesday. With that, this meeting is adjourned. Thank you.